Geiger.
Here.
Miss Vetter.
Here.
Mr. Ruiz.
Here.
Mrs. Edwards.
Here.
Mrs. Labuda.
Here. Okay, we're going to start off with reports, the HEAL grant update.
Hi, thank you very much. I am happy to say that phase one of the HEAL grant reconstruction at the nursing home has been complete. We have moved all the residents and offices and departments out of the Unit 1 area, corridor, etc. The lobby is closed. Unit 2 is where everybody went. It is still not a dementia unit, quote unquote, at the moment, because that will occur once phase 2 is complete, and that we'll be able to have both Unit 1 and Unit 2 open. In order to have everything done for phase 2 to begin, and the lobby being part of the work, the old regular lobby is presently closed, and we're using right now a temporary entrance to bring everybody in and out of the facility. Any questions?
Okay, any questions for Debbie?
No, but I took a tour with it, looks great, and I just can't wait to cut the ribbon, and you guys are doing a great job, so keep up the good work, hopefully it'll be successful over there.
Start to make us some money.
We'll work on it.
Okay, Commissioner Parker, homeless housing update.
I have Giselle Stackedy with me today, the Director of Temporary Assistance, and Giselle has some figures to update.
Okay, currently as of today, we have 62 homeless cases. That is broken down into 19 families and 43 singles. And those individuals are still being housed in the 10 motels that we have. As a result of the RFQ that had been put out for housing, we did have someone come forward who had housing units that he wanted to work with us to help transition some of the people out of motels. He has proposed providing us with 2 houses, a 5-bedroom and a 7-bedroom, that we would be able to transition approximately 12 adults into, and they would be singles, that we would be able to get out of those motels into some kind of permanent housing. We're adding a case management component to that project, since this is the first time we've done that. So those individuals will have someone working with them for the initial 30 days to make sure that they're getting the services such as employment, and that we're helping transition them into this as well. The housing task force that I'm on, Sherry Truss, that's on the task force, has also mentioned there's a tenant skills class that they offer free to anyone who's interested. So we're reaching out to her so that we can have her do tenant skills with these 12 adults, and we can work with the landlord to make sure that this transition goes smoothly.
So you haven't signed a contract yet, correct?
No, there's no
The
contract.
question is, in the facility where there's 5 bedrooms and 7 bedrooms, and you're gonna have 5 people in there, whatever, it's gonna be the county insurance or the landlord's insurance?
Landlords.
Okay, and you're gonna have somebody stay with these 5 or 7 people, is that what you said? Like, they're gonna be in this?
There's gonna be a case manager. They're gonna be living here like this is where their home is. But there will be a case manager Monday through Friday that will be there, and then the landlord's also gonna have a caretaker to just keep an eye on the property and make sure everything's okay.
And when are you gonna be signing the contract?
We're looking to do it like within a week or so.
But there is
But
no
there-
contract that
Yeah.
between us and the landlord. It's just going to be a rental between the landlord and each individual tenant.
So, okay, so what would be the savings then?
I mean,
We
it's
take them out of
getting,
hotels
it's
and put
getting
it-
individuals out of the
Hot-
motels and
Mhm.
into a more permanent housing setting. I mean, the
Mhm.
individuals can reside there as long as the lease period, and if they choose to continue to live there, they can live there. I mean, it's no longer, they would no longer be considered homeless.
Well,
They would-
I think what you were asking is there any liability to the county?
I mean, it's a similar situation to anyone who's receiving temporary assistance and their rent is paid. with a local landlord. So it's a similar situation, there's no contractual agreement or arrangement between the county and the property owner.
But will we be saving money? Because I thought the whole idea was to move them out of the hotels into these houses to save money. So is there savings, or we're not sure yet?
Well,
We're sure
eventually,
we're not
right,
paying
when
the motel.
when you transition them from the motel, I mean, currently, right now, was the number 10 motels that we're utilizing currently. So this transition of the 12 adults is a start to move them from the motel conditions, which were less than favorable, and save the money on the contracts with the hotels, correct?
Correct.
I mean, we've already had the initial, when we reduced the payments over the course of the last year to the motels. This is to get people in permanent housing. I mean, right, the motels are not permanent housing. So the cost savings in terms of, I mean, it may be neutral with the shift from motels, but the individuals are in permanent housing. And that's an important part of it.
And I agree they should be, it's better for them to be in housing. But my question is, if there's not a contract with the county, what kind of agreement do we have with the landlord? Sam, can you answer that question?
We will not have any contract or agreement with the landlord. There's hundreds of cases where individuals receiving temporary assistance have rental agreements with area landlords, and that's between the individual residing there and the landlord. Okay, we have that arrangement right now. There's no contractual relationship there. This individual has 2 residences that he's willing to work with us on in terms of moving people from motels into his residence. He'll establish a lease or an agreement with the client residing there. So there's no contractual relationship between us and the landlord.
This is Cora. What difference does having a caseworker make?
It's to help transition them because right now we do have case management that works with people in the hotels. Being that this project is new to us as well, we worked with the landlord to try and make sure that we get them services with employment. If there are any barriers that they have to, getting on their feet, whether it's employment, transportation, we want the case manager to help pool the resources that are going to be in that general area to help that transition.
So that means that right now we don't know whether they get jobs or not. So having a caseworker is going to help us know whether they got a job or not?
I mean,
Cora,
what has been in existence for some time is we have a homeless case management contract with RSS. DFS has had a long-standing case management contract. And we also have had staff, a case manager, and a senior caseworker assigned to the homeless population within the agency. Now with the number of homeless decreasing over time, we were able to shift some resources within the agency, and between the homeless case management contract and our case manager on site at DFS, we're able to focus on specific populations within the homeless. The remaining homeless, Giselle also had some data on the average length of time they've been in the motels?
Yeah, for the average length of stay per family is 159 days, so it's a little over 5 months. And the average length of stay per adult, single, is 114 days, which is a little over 3 months.
So and with these individuals and these families, it's not just homelessness that is an issue for them. You may have individuals with substance abuse issues, mental health, other complex needs that they're obviously, many of them are not employed. So it's coordinating with the Center for Workforce Development, job search, vocational training, etc. And again, focusing on reducing the length of stay in the motels, getting them in more secure permanent housing, and contributing in terms of employment.
So can one of the goals be actually that they come off the tax rolls by working?
I mean,
they're contributing to, the tax base. as a
I
result of
think so.
having a caseworker? Is that one of the goals?
I mean, it's self-sufficiency, yes, all throughout all the programs at DFS, the cash assistance programs, that self-sufficiency and non-reliance upon governmental benefits is a goal.
Excuse me.
Okay, because that's what I'm hoping, that as a result of having this change with the caseworker load, that we have more people who are actually working, because I think our unemployment rate is somewhere hovering around 14% right now.
Cora, if you recall, when we visited the county that we looked at their housing, the caseworkers oversaw these people in the homes. They weren't, they were directed to find the job, so that was the piece that was working up there. They were monitoring those homes, those
That-
case managers.
That's what I'm not clear on. If we go into this system, and I'm certainly glad that we're going into something, please understand that. But when we went up to Delhi and we looked at the system that they had, I thought we were
Delaware
shadowing,
County.
modeling that system in that the case, that the person who was taking advantage of the home, the room, made sure that they kept their own quarter clean and neat. They had to apply and be at some place in particular by a time in the morning. So if we're not having a contract with any of these people, how are we going to accomplish that?
There's still going to be, when they are placed either in a motel or in another form of temporary housing, there still are rules, and there still are, what is the ILP, the
Yeah, the
individualized
independent
living,
plan
independent
and
living
just
program.
what your goals are as far as going for employment or seeking out an apartment. And they have a set of goals that are worked on with their worker right now when they're going into a motel.
So how is this different? I mean, we're looking to get them self-sufficient. I
The
thought we were modeling.
The expectations are much different than they have been in the past. Right now, what happens is if someone comes to the agency and says they're homeless, they are interviewed. Okay, then what we are going to do, rather than putting them directly in the temporary assistance line, is we're going to have a case manager, caseworker, work with them about, are you truly homeless? Is there really another place where you can go? Okay, and we have already started to do that, but we're going to gear it toward one person. That's going to be their responsibility to do. And then if they are truly, they have nowhere to go and they need to be housed, then they'll go through that temporary assistance process. But the whole participating with the Center for Workforce Development, the whole issue of having to go to orientation, doing your job search, possibly attend a substance abuse assessment at community services, all of that is done on the front end and with a lot of attention to it. And then if those that we do have to house, that follow-up in the 30 days will be help determine if they're going to continue to be eligible to stay in that form of housing, and we need to link them with the various services. I mean, everything, the pieces have been out there in the past, they haven't been coordinated. I think Giselle has done a good job at pulling it together, coordinating it, and moving it forward.
Okay, got it, Randy. I understand what's happening now.
So we're really all modeling after the county that we visited.
We are. I mean, what we don't have is, we don't have.
That had a contract.
We don't have a relationship where we own the
Right.
housing,
Right?
nor are we contracting with a private landlord. I mean, this particular individual is willing to get into a landlord-tenant relationship with the 12 individuals that removes us for liability purposes
Right.
with that, and allows us to pilot it and work with these 12 individuals. I think it's.
How long is the pilot period, Randy?
I think we have a timeline on that.
I mean, we don't
I think
necessarily have
we
a
don't have the people
timeline. I
in there.
think, I would say a 12-month period with this particular provider.
Okay, and you'll be giving us updates on a, monthly committee. Are there any
Again,
other
the goal
questions?
is with the 62 homeless cases to continue to reduce that number of, and individuals and families residing in motels.
Giselle, I just had a question for you. Out of the 62 cases, how many individuals and how many children of that number? Do you have that?
She said they were all
You
individuals.
did, didn't you? I thought you did.
This was
I
not
did
gonna
break
be
down the
family, she
family
said.
individuals.
That's what I thought.
Okay.
Total number of children in that number is 36 children. 15 male, 21 female,
36 total.
36 total children.
Okay.
And it's a total of 65 adults, including singles and the family at head of household.
Okay, thank you.
You're welcome.
Any other questions for Gazelle? Thank you. We have Jerry Dietz, the fraud update.
Right now, I think we're at 35, 36 arrests, one for child support, and we're continuing going forward.
And I believe next month you will give a summary report in committee. Is that what we talked about?
Yes.
Thus far, right?
That'd be good, I'd like to see how much money would the county say.
Yeah, that was my question.
Ways, how many were arrested, were they put in jail, were they released on ROR, I'd like to have all those numbers, please.
Okay, any questions?
Nope, that was good, thank you.
Okay, Nancy McGraw on the EI escrow update, insurance. Where's Nancy? Okay. Okay, the foster care quarterly update, we're gonna do that next month. Is that what I understand?
We have data.
Oh, you have it?
If you want it.
Yeah.
That would take 2 minutes.
Really, 2 minutes?
2 minutes.
No, not a county 2 minutes.
Foster care financial quarterly.
Real 2 minutes. All right, we've been asked on a quarterly basis to report foster care financial data starting this month. So what we did was gave you on page 1 foster care cost by payment line for January 1st through June 30th, 2013. And you can see the various amounts. What page 2 is specific to contracts that we have for foster care services. The time period covered here would be that contract period, which was July 1st, 2012 through June 30th, 2013. So that contract period is over. You can see the list of residential facilities. It has a maximum contract amount, and then it has paid to date during that service period. So what our intention would be is to, on a quarterly basis, and we'll always be, I think, a month, 3 months behind, but I think the next update would go through 9/30/2013. I don't know if this is in Cora. I think, Cora, you may have asked for something like this, and we're at a disadvantage because you can't see this right now.
That's all right, if you can just make a copy of
Yeah,
that
we'll
for
get you a
me, and
copy.
I can have it in the mailbox. The main thing was that we're able to, make a determination over time, because we didn't really have statistics. They were all lumped together year by year. They weren't brought to us, on a quarterly basis, which helps us kind of look at the picture a little bit more detailed.
So this, my understanding of this is like Children's Home of Wyoming Conference. We have no children in that place at this time? It might-
Oh,
We should have someone there now. Generally, we do have at that.
Then what's that fourth column saying, no children, no children?
Maybe no children.
Yeah, I think as of 4/1, there are
One.
probably no
No
children,
children
because
there.
that one has it up until 3/31.
So there's 2 places that we don't have any children in, is that
Right,
correct?
community maternity services, we very seldom have children there. That's for pregnant teens.
Okay, so there's 2 places that we don't have children. So that contract amount is the amount that we give them just to keep the place open for us?
No, we
No,
don't
it's a
give them
placeholder.
money. It's not, it doesn't hold beds. That is just a figure, not to exceed if we do have children placed there. If we don't have any children placed there, we don't pay anything to them.
Okay. So the paid to date is what we have paid for.
Mm-hmm.
Yes.
Yes.
And that was for that contract period, for July 12th through June 30th, 13th. So now
Now-
we're in a new contract period, so the next time we report on this, we'll show you the maximum contract amounts for 13, 14, and then what the expenses have been in that first quarter with those respective facilities.
Now, a number of these facilities, they're supposed to be doing the transportation. Am I incorrect in that thinking?
There's a standard, go ahead, Bob.
Yeah, they seldom do transportation. That really falls on the staff here.
But isn't that part of their contracts, when you contracted to them, that they would be taking the children back and forth to the various things? I mean, wasn't that in the contracts?
I don't believe so.
I mean, it's something that we're looking at within the boilerplate. It's a state-approved contract. There's a case management function and a case planning function. We're the case management function. When we purchase a placement, the case planning function, we just need to pay closer attention to what the, say, Abbott House responsibility is and what our responsibility is at the time of placement. I know transportation for visitation in particular becomes an issue. Some providers are more willing to do the transportation, and we just, on a case-by-case basis, need to refer to our contract and manage the contracts to just get the provider to do what we're paying them to do.
I mean, that is part of a number of the contracts, correct?
Yeah.
And we're using ourselves to do things that we're paying them.
I think the foster care staff that we have are from the mindset of do what it takes to get things done, and I think it behooves management to make sure that we're not having them do work that we're already purchasing
Right, I think
from the
we need
private
to
agency. So
address
we're,
whether,
We need to firm that up.
Specifications.
Yeah, a lot of times there's an extra expense for them to transport children, and a lot of these agencies don't have staff on board for that. They have staff for the services they provide at the facility.
But at the facility, you know, not to give you a hard time, in the contract, if I'm supposed to do such and such, and I sign that contract with you, then it is my responsibility, whether I have the staff or not, to do that.
Well, a lot of the transporting that we do is about the parents going up to the facility to participate in the programs. And the facilities are not necessarily providing services direct to the parents unless they come to the facility and participate with their child. So a lot of the transportation that we do is bringing parents back and forth, not so much about the children.
Thank you.
can we just check that out, that piece about that, the contracts versus transportation? That would help out. I just wanted to, as far as foster care, because we had discussed, you know, kind of changing the program somewhat to kind of transition children out of these institutions. So what, do you currently have a number for the children that are in these institutions?
I wasn't aware we were gonna be discussing that today, and so I'm not prepared.
Okay, that's fine.
But if you, let me know what exactly that you're looking for, number-wise, I can have that for you.
Okay, because I know we had discussed the foster care needs, boarding home, family reunification training. Has anything been looked into
Well,
so
one
far?
thing that we did start is we started working with occupations to try to move children home a little quicker. They're doing a lot of work with the family here and participating with the family and the children at the facility to prepare for earlier discharge. Off the top of my head, I believe by between June and the end of August, we had 4 discharges through that program. Some of those kids probably would have stayed until December of this year.
Okay, so they're back in county in a
In
foster
county
home?
with
their
their
parents.
families. And then the services continue to support that return home is successful.
And as far as, I believe there will be a foster care certification class this fall.
It started Tuesday.
Okay, and did we see an increase in any numbers of recruiting foster homes?
No, we did do a advertisement on the community bulletin board. I thought that it would generate a lot of calls. Unfortunately, it did not. You know, maybe about 10 calls in total for that 20-day period.
And I referred to someone, I believe, another 3 or 4 that have come through me.
Well, have you considered using the families who already have children as foster families to help with the outreach for other recruitment? Because they're quite a body, they're quite a strong group of people.
Yes, Randy and I have discussed that and some other possibilities that the foster parents themselves could participate in to get the word out and get some new applicants.
A thought occurred to me as well. If we've held the classes twice a year and we have families that finish the class, it may behoove us to recontact those families and ask them if there's still an interest in
They do.
completing.
They do. It's an ongoing process, and those families that have not completed are invited time and time again to participate in the classes and to finish the process.
They've been re-invited to come back and...
If they have not completed, yes, they're invited to come back.
I wish I got that call. Okay. So we are reaching out to those certified, people that were certified or close to being
I
certified.
mean, the whole foster care, I mean, what we're trying to do is reinvigorate the local foster homes. And there's
Right.
been a Sullivan County Foster Parent Association, and that's key. That's a big, important step to what we're trying to do. And that consists of local foster parents who meet on a monthly basis. Barbara's attended a couple of meetings, I've attended a couple of meetings. We want them to get meeting again.
With 19 families, is
Uh,
that what?
They don't all participate.
More are starting to come now.
Okay,
that
that's what
they're-
I'm trying to get at.
So what you do as you're licensing people, as they complete the training, is you kind of pair them up with the association, and whether the new folks get a mentor or not, you get them in with that group, and then they'll have informal supports as they begin fostering. What happens with foster parents, and this has been extensively researched across the country, is that people are thinking about it for about 2 years at the point they decide, hey, I want to do this. Normally, within a couple, one of the people really wants to do it, the other one's not real sure. But at the point they then approach you, they want a child placed with them tomorrow. Well, the process in the system does not allow for that, because you have to do some pretty extensive background check, screening, and then training. So you're really gonna look at, from the time they reach out to us, we do the home visits, the licensing, the training at a 6 to 9 month period. During that time, people want children placed with them, but you can't do it yet. What's difficult here is having the 2 standardized trainings a year. Like when Barbara completes this one, if someone says, hey, I wanna, become a foster parent, you have to put them on hold until the next session. We're working to find out if we can use Orange and Ulster and contiguous counties to plug people into training too. So there's many different things going on. Barbara and I have talked quite a bit about how to reach out locally in some non-traditional ways to find foster homes. But again, research also does show that using your own foster homes to help market your foster care program is highly successful. So
Well,
we will use that approach.
That 6 to 9 month process, and I understand there's a lot to it because I went through it, but is there any way to make it, that time frame a little bit shorter, shorten that up?
No, the training is prescribed by the state, and it has a set curriculum to follow. On occasion, we have done one-on-one with people. And also, I want to add about the Foster Parent Association is that they are invited and do participate in the training. They come in and speak with the applicants about the association and invite them to join. And also a part of that training process, we arrange for one of our foster children who feels comfortable to come in and speak with them about their experience in foster care and what that means for them.
Right.
So there's some exposure to at least one child and to the Foster Parent Association.
Right, and I understand the steps. I just didn't think that, 9 months is a little long, I think.
I mean, we need homes, and we know we need homes, so we're gonna do whatever it takes to get more homes. So if we have to individualize trainings, customize trainings to license, additional homes, we just also want to be very cautious and careful with potential applicants and make sure that they can provide a safe home for children. So
I think that the process that I went through was very good in, looking at every aspect of your home, your background, all that. I think that is a good process. It just seemed like it takes longer than it could. So
Well,
as
so-
long as you're looking into,
we are.
yeah. Okay, are there any other questions? Okay, is Nancy back in? Oh, here she is.
Apologize for stepping out. I was actually getting an update for you on the EI escrow issue that you want me to report on. Our balance last month, as of September 5th in our EI escrow account was about $6,300. We've been asked to make another deposit of $19,904, I believe by the 19th of September for the EI escrow account. And our fiscal officer has sent that to Ira's office.
But I think part of the reason also this was on the agenda because of the issue with the state wanting to advance.
The state wanted the advanced EI escrow payment last month, but they've since withdrawn that request because the counties said basically no. Nobody wanted to do that in addition to the existing escrow account. So they're trying to get some things straightened out at the state level. They're providing more training to our providers in terms of how to bill third-party insurance to try to resolve these claims and to get things moving. And it seems to be starting to move in the right direction.
Okay. Are there any questions for Nancy? Okay, we have a presentation, a broad overview of the Child Protective Services process, and I think Commissioner Parker was going to cover that.
Yeah, I'm deferring to the expert, Barbara. But we had submitted a packet at the July meeting, so we have copies
Thank you.
of that again. I was able to come through with that.
Thank you.
And this was handed out at the last.
Yeah, we really didn't get time to review it.
So the intent is to just have a very broad overview of how Child Protective Services works in Sullivan County.
This is a different one? It's the same
There's
thing?
two different packets.
Oh, I don't know. This looks the same.
This one's different.
One says additional information on the cover and the other says CPS investigation.
So the additional information was what we handed out in July, but we were asked to make that available again, so we copied it.
We received these in July, I believe.
I got it.
So Barbara's prepared to just give
Do you
a
have the other one?
general overview of Child Protective Services, and then we can answer any questions.
Okay. In Albany is the New York State Child Abuse and Maltreatment Register, and they accept calls from all over the state. If they accept a call, it becomes an official report, and then it is assigned to us here in Sullivan County. to our Child Protective Services unit that is immediately assigned to an investigator. We get reports around educational neglect, condition of the home, lack of medical care, lack of supervision, not having food. I mean, the list is endless. Also, we get calls regarding physical abuse, sexual abuse, and domestic violence, and fatalities. Those are assigned to our family violence response team. Currently, we have 2 investigators, CPS investigators, assigned to that team. We are going to increase that to 3. And we also have a New York State Police investigator who's housed in our office and does these investigations. They do it as a team. Some of those result in arrests because there's been criminal activity. We are required to complete a safety assessment within 24 hours of receiving the report. We have to interview all persons named in the report face to face. We have to assess the conditions of the home, that they're suitable and safe for children, that there's no safety hazards, and any serious issues have to be addressed immediately. We make contacts with police departments, schools, hospital, doctors, relatives, neighbors, just about anyone that's relevant to assessing the care that's being provided to the children by the parents. When issues are identified that do not require immediate actions, sometimes referrals are made to preventive services. Sometimes if it's a food issue, we refer them to food pantries or to apply downstairs to see if they're eligible for things like food stamps or Medicaid. It depends on what the need is. That's where we refer out to. We have 60 days to complete our investigation, and within those 60 days, we are required to do a 7-day safety assessment as well as a final safety assessment. We complete what we call a risk assessment profile, and this is to help identify how high is the risk for the children in the family. And with that, you take a look at several factors that help you make that determination about drug and alcohol use, domestic violence, mental health issues, what kind of supports does the family have, whether it's family members or their local religious group, or who do they depend on to help them out, and also determining that basic needs like food, clothing, and shelter are met. All information gathered has to be entered in Connections, which is the state system of record, as well as entering progress notes that provide information about the conversations that you've had, what you've observed, and what actions you've taken. The final determinations are made at the conclusion of the investigation, and those determinations could be unfounded, meaning that there is no evidence or not enough evidence to substantiate the allegations. Indicated, meaning that there is enough evidence to prove that children have been neglected and or abused. Indicated cases can be closed as the problem in the family has been addressed and resolved. Other indicated cases might remain open as the issues require the aid of the family court, and then we would file petitions alleging neglect or abuse. Sometimes court intervention is needed to generate orders that direct parents to do certain things that will help them better care for their children and rectify any issues that they have in their home. That's kind of the short in the big picture. I've also attached from the Child Protective Services Program Manual a definition of protective services for children, as well as the legal authority that we have and the local district's organization regarding child protective services.
So some of the key points are there's a 1-800 number if someone suspects child abuse or maltreatment in Sullivan County. It's preferred that they give a name and a contact so that we can follow up with them, but they can submit the report anonymously. certain professions are mandated reporters if they are in a child-serving capacity. And historically, for probably the last 4 to 5 years, we've averaged 1,500 reports per year.
Those are the calls,
That's,
correct?
those
Yes.
are the number that the
Yeah.
state has accepted as actual investigation and then assigns to our district to investigate. So 1,500 on average.
And then they go into a petition form after they're screened through the state,
No, it doesn't become a petition until the local district determines that the needs of the family require that. A petition be filed with family court.
so I think the number was about 54 petitions were filed?
Yes.
Is that what I saw somewhere?
And that would either be a child abuse or neglect
neglect.
petition where you're asking for the family court intervention on behalf of that child or children in the family.
And so out of the 54, then, some, like Barbara said, would be unfounded.
No, out of the 1,500, some would be
Okay.
unfounded.
And then they go 54 petitions.
Out of the indicated cases. But that's not the total number of indicated cases. The 54, that's just the number of petitions that were filed with family court.
Okay, and then family court would determine out of the 54 petitions, which ones, what resources to pull in, where,
The family
what
court would
recommendation.
decide if these situations are truly neglect and/or abuse first. If they make the determination that the children have been neglected and/or abused, then the family court would make court orders directing the parents to participate in certain types
They
of
would have a course
services.
of action, right?
Yes.
Mhm.
And then we would monitor those court orders and the progress of the families. And also some services we would assist with, and for others, we would help them get appointments and transportation to things like drug and alcohol counseling or, mental health counseling.
Okay, and, in just reviewing the reports that you submitted,
Yes.
the percentage of timely assessments, percentage of overdue investigations, and those numbers like that, is there anything that can be done to kind of improve, those statistics there?
Well, we try to make a concentrated effort, and we have been even more so over the last couple of months, to clean up our overdue and also get our assessments in a timely fashion so that we meet the 7-day requirement for the first assessment. A lot of things impact that. Increase in calls, the seriousness of the calls, if we have weekends with a holiday, those days count. So it's a bit of a struggle to meet that 7-day, but we are working to improve and actually get it done.
So is that, the staffing levels that's
The staffing
affecting?
is also an issue, when you couple it with, we've had occasions where we've had more than one person out on a medical leave, then you throw in vacations and just normal absences, and sometimes that has left us very short.
Because ultimately, you want these cases to be through,
Within the 60 days, if not sooner.
right.
So during the month of August, there were probably, I think there were about 240 cases open, and 25 to 30% of those were beyond that 60-day investigation period. So I know Barbara and her child protective supervisors and staff were making a concentrated effort to make final decisions on those cases. And once they catch up, then they need to remain caught up and moving forward. But I think we talked about it in July a little bit. Structurally, with the number of investigations, a 60-day investigation, we have 13 investigators if you run the numbers and, trying to keep under what the state would want you to be under 15 investigations at any given time, they need 3 more child protective investigators to, on an ongoing basis, be able to stay under that number. And again, we're looking at internal staffing and where we can utilize staff to do these investigations, and then attempting to address it in the 2014 budget process.
So currently, there are over 15 investigations on the caseload?
There's one indicator in there under this additional information packet, where the headline is percentage of workers with more than 15 CPS investigations. This report was May, and I think we had 92% of our open were, 92% of our workers had more than 15 investigations. But again, if they can address that, what we would call backlog with cases over 60 days, then that percentage will decrease. And this is a monthly report that we get from the state, so I'm interested in seeing how August looks.
Because ultimately, it could have implications for the children too.
That's what we're most concerned with, is the safety of children. And, the one indicator with the 7-day assessment, the state did come and do a child protective review recently. They said they do very good, thorough, quality investigations. Something like the 7-day assessment is done, it's just not entered into the computer. So again, Barbara's been working quite a bit with the staff at addressing some of these issues.
Okay, thank you. Alan?
Yeah, just looking at the tables, there certainly appears to be a need for additional CPS workers. Do you have, I'm not expecting numbers right now, but do we have an idea of what percentage of their salaries would be covered through by state?
It's 75 to 80% would be covered of the salary and benefits. Part of the issue, and it's historical and long-standing, is the child protective investigators are senior caseworkers, and that is how it has been. So what happens is, when we have a vacancy, turnover, someone leaves as a CPS worker, I don't have my preventive and foster care workers who can then transfer to CPS because they're at a caseworker level. In an ideal world, you would have everyone trained to do CPS, so then in the event you had a vacancy in CPS, you could then reassign the work. But because of differentiating the CPS as seniors, we're running into an issue when we do have a vacancy of having a trained workforce who can jump into CPS. We've had some preliminary discussion with the union about the classification of the positions, but it is a little bit of barrier.
Right?
And then when you have a new worker, the state will not allow you to assign them as primary investigator until they are fully trained, and it takes 6 months to have them fully trained with all the training the state requires of the CPS staff. So the object would be to have staff who are already CPS trained, who are on board. If you had a vacancy, boom, you could plug them right in there and continue the work.
Okay, it sounds like you're looking into it.
Yes.
Anybody have any other questions? Okay, we're gonna move on to our discussions. The mandate relief prioritization, that will be for next month. We'll ask Joe Todoro to give us a private adult home governor's initiative update.
Okay, as you may or may not recall, I'll answer the camera for a moment. I'm serving as a Sullivan County representative. This is a document you guys can look at, as well as the Conference of Local Mental Hygiene Directors representative on this committee. And it's a committee to implement the regulatory changes that require adult homes of 80 plus certified beds to get underneath 25% of the number of people living in their residence, being those people with serious mental illness. This was the first meeting, and at the first meeting they gave us a scope of work. I'm not going to read it to you, you guys all know how to do that. But I can tell you that there was one disturbing finding in that committee that I believe most of the directors and the advocates for folks with serious mental illness kind of took a hard swallow at. And we asked about, as you're aware in the regulation, the state required the adult homes that are affected to send in a plan to get down to that number, less than 25% of their total census being people with serious mental illness. What we came to find out was that if you have an adult home of 80 certified beds, your plan could be to decertify one of those beds, and the state would find that
I
satisfactory.
see. They found a loophole.
So the advocates and I all kind of said, I don't think that really speaks to the spirit of the Olmsted findings, and we have a problem with that. So I think that that's one of the things that we'll be addressing in this committee. So I just wanted to provide you with this brief. Next month, if it's all right with the chair, I'd like to brief you on the Regional Centers of Excellence plans from the Office of Mental Health. That will have an impact on the lives of people with serious mental illness in on Sullivan County, and I wanted to just give you a brief on that next month if it pleases the chair. So thank you very much. I try to keep these brief so that we can move along.
Are there any questions? Okay, we're going to move on to Center for Governmental Research report, the CGR report. Josh has a presentation.
So a few weeks ago, the Center for Governmental Research, which I'll refer to as CGR, issued while this loads up, it took them about a year, and they issued a report on all the publicly owned nursing homes in the state. And what this presentation does is basically takes their 150-page report and summarizes it down, and basically talks a little bit about their methodology, what they did, and then the primary thing for legislative bodies in the state is they make recommendations to the state and to counties on how to address the fact that you own a nursing home and the challenges you face. The full study has what gets it to 150 pages. There's a lot of case studies. They drill into some specific cases of counties getting out of the business. They get into a lot of statistical information that this doesn't necessarily address. But so like I kind of basically said while this was loading up, it's a year-long study, and it identifies key consequences of what counties have done in the near past, whether they're divesting or entering into partnerships with private entities. And then it, like I said, it gives policy guidance to state officials and county officials on how to address the nursing home issue going forward in light of the fiscal challenges that they're facing. So like I said, it was on all the public nursing homes, and they made a comment that what is driving this is that 92% of the county-owned nursing homes in 2010 lost money, which we are one of them. So there's not necessarily new news to any of us sitting here, but they thought that was important to stress. Basically, I mean, and you kind of know that the nursing homes face challenges, a lot of it being due. Skip one home, sorry. So this is what their methodology. There's 35 homes currently operated within 33 counties. So obviously, a couple counties have a couple nursing facilities, and you can see when you take that, there's about 8 in the process of selling and about 5 actively considering. So 13 out of 35, so about a third, are in the process of either trying to actively sell or actively looking at divesting themselves of their facility. And 4 homes have been sold by counties since 2005. The most recent, obviously, is the Ulster County, our neighbor to our east. And 2 homes have been just outright closed without selling to a private entity. And then they kind of go through, I won't go through all that. They used basically all the finances of all the facilities, which is all public information reported by all the facilities up to the state. So they're basically taking all the financials from all the facilities and to generate their report. So obviously the nursing homes generally operate at a loss per day or a loss per bed per day, which they refer to, and that has kind of skyrocketed in recent years partly due to employee benefit costs. As you know, bills have skyrocketed due to the recession, and the stock market performance and health insurance has gone up, not nearly as much as pension, but it's still gone up at a faster rate than it may be going up in the private sector. And they go on to say that the results of the sales and closings have been mixed. There's definitely a mixed bag of results. And as you'll see as they go on a little bit later, there's anywhere from myriad of services being improved in some cases to, on the opposite end of the spectrum, there was a facility that sold to a private entity, and then the state came in years down the road and closed them because of performance. So you see the key there is, and what they kind of stress is that no matter which route you take, there's got to be some due diligence, and if the route is looking toward divesting, it's really key to have a proven and a vendor that has some track record in New York and has some success in the state. So then the recommendations, which is kind of, to me, the key point of the report, a lot of the other stuff is not necessarily news to us as running a nursing home, but they're stressing that the state must work with the federal officials to ensure the future availability of the IGT funding. Our auditors, who had some ties into what the conversations going on, has pretty confidently stated they feel that the IGT is pretty secure through 2015. Beyond that, there are no guarantees, and not too past, there's always been discussions because it's a joint state and federal funding. I mean, the county even shares in, but in times of budget shortfalls for the feds and state, and they kind of always looked at this as a place to potentially cut. It hasn't necessarily been cut in recent years, but it's always something that is discussed. And then the second thing for the state, they should provide supplemental financial incentives to nursing homes that have hard-to-place residents. Primarily, I think they're speaking to, you have a lot of Medicaid patients, but I think, as you know, I wouldn't necessarily count on the state coming up with necessarily new funds for county nursing homes. And then they go on to say the state should expand its role in partnering with counties to carry out due diligence assessments in exploring the future options of nursing homes, and the state should provide incentives to help counties expand community-based long-term care solutions other than nursing homes. And I think the worth of looking at is less costly residential services than what it costs to run a nursing home, where they're kind of stressing and looking at trying to keep people in their home, that we can have a CHA service them or some other home health aides versus running a facility for permanent placements, which is much more expensive. And then they go on to their recommendations for counties. This is in essence their first step before you would in essence make any determinations about keeping it, improving the operations, or looking at other models of running the facility, whether it's privatization. So you can kind of see they determine if there's a bed shortage or surplus in the county. To my knowledge, the last, I don't know, Debbie or Andy know, the last time this was really looked at, I think it was the Burger Commission, and didn't necessarily have a shortage or a surplus, so we were they weren't looking to close beds, but they didn't necessarily say we needed to expand at the same time. So I don't know, that was probably 4 or 5 years ago. They stressed that we need to analyze the population projections for the county, especially in the age groups and demographics that would be using these facilities. They stressed that we should look at us serving the Medicaid or the hard-to-place residents and how much our facility serves that population, and if there would be places for them to necessarily be served if it was run by a private entity or didn't exist. And then they stress that you should analyze the availability of long-term care services other than nursing homes, again looking to try to have potentially cheaper in-home services versus running a nursing home. And then, to me, this is kind of where they would look to see if you're looking to, there's 2 different bullets here. One would be if you're kind of looking to keep in the business. They gave some examples of where they had, some counties had a union that represented the whole county, and they split off the nursing home population to try to get some more bargaining ability with that specific union and their unique needs. They're a lot different, obviously, than our more administrative offices, and you need some flexibility with schedules and other things. And then and then number 2 on this would be more if you're looking to kind of at some point look at the divestiture option or have a privatization option. So the report was pretty comprehensive, a lot of information. We tried to get it down to something that was a little high level, and if there's something that the board would like to look at further or different options or what the board would like to look at, I mean, we can have staff and drill into more granular data, but this was more of a first attempt at a high level overview of what CGR recommended for counties across the state.
Any questions?
If within this packet that we received about the presentation today, there's a section, Sullivan County Adult Care Center monthly report, that would pertain to this, would it not? Okay, so that's where I have questions. Looking at the May versus the July, the amounts of money that we have spent, and then looking down at the number of people that we're serving, we seem to be spending approximately $2,000 more per month and serving a number less, no matter where I'm looking. And I'm not clear on the why. You know, daycare, 296 down to 279. The swallow hearing test, we did 48, now we're down to 2. You know, physical therapy was 193, it was up as far as 205, down to 190, and yet we're spending a lot more. I'm not clear on why those numbers
Oh,
are.
you'd probably have to look at the census numbers, right? The percent of occupancy?
Well, I'm looking at the various things there, and no matter what I'm looking at, it doesn't, activity participation, 93.48 down to 80.72. No matter which number I'm looking at, less people seem to be taken care of or participating in things, and yet $2,000 more per month is being spent. I don't understand.
I mean, the big issue is with the HEAL grant is closing an entire unit. So you go from 160 to 120. And then even within the 120, in terms of logistics of the units that are under renovation, with Debbie, the number is probably 114.
Right now, it's 114 is
114.
potential.
And with the going from 4 units to 3 units, there was a point in time where they had to suspend new admissions and we're not taking longer term admissions. So we are, with the phase 2, we're eager for phase 2 to get started and get going and get completed so that we can open back up the 4 units. I think with the acute care and then the case mix, and Debbie can speak more in detail about that, that's going to help on the revenue side. And then, you know, with the acute admissions, but staffing, we have left a number of positions vacant when we went from 4 to 3, but it is, everything revenue-wise is related to from the 160 down to 114 right now. That's the loss of revenue every day that we have a unit closed.
Because ultimately, you want all your beds occupied. So I guess my question is, if we're neither on a shortage or a surplus of beds and we're flat in Sullivan County, if, you know, for argument's sake, if the dynamics were to change in the county where, you know, beds were needed, there was more of a need for the beds, wouldn't that put us in a better position?
I mean, there are a number of factors that go into the census. For example, as of this morning, we have 110 people within the facility as residents. Our capacity is 114 right now, with the unit being closed and the number of beds having been reduced within the unit. And we have 3 residents who are presently in the nursing home. They're long-term residents with the word that perhaps 2 will be ready to come back today. So as you're looking at your census, percentage-wise, et cetera, there's multiple factors that go into it. And when it looks at expenses, for example, all depending on who we get in for those stays, how much their medications are, what kind of treatments they need, et cetera, is going to increase or decrease or level out the expenses. So it's multiple factors that go in when we look at those numbers. And in terms of the number of beds needed, et cetera, within the county and why your census would be less than 100%, some of those factors I just mentioned go into it. So you have somebody who's in the hospital, and right now, because of the number of beds we have out of the system, we're not gonna reach a bed hold limit because we have a large vacancy rate as per out of the 160 beds. But when I actually look at what we really can fill at the moment, it's 114. Having 110 filled, 3 people potentially coming, 3 in the hospital, 2 potentially coming back today, which will bring us at 112. And then, of course, when you look at census, I might unfortunately have somebody else go into the hospital. We might, on a good hand, have somebody who came into our facility, got the rehab, and has gone back home to the community. Or there are those cases where, unfortunately, people die. So that's, many factors into why those census numbers and why the expenses will either go up or down depending upon the month.
But so in 14 and then going forward, with the HEAL grant, we're reducing occupancy from 160 to 146. That was part of the HEAL grant. So with the 146, you're also going to have a different population with the acute population than what you traditionally had. You can have more short-term folks, probably a younger population rehabbing in the facility, and then but more in and out from that age range. So you're, depending on what the need is in the community, you are reducing from 160 to 146, and then with the acute really taking beds from what would be the more traditional nursing home population.
Well, the whole idea of the HALE grant was to make that facility, to renovate it, to put the Alzheimer's unit in so we can, because there's not one around this area, and to hopefully at some point break even, because, of course the taxpayers, it's always running in the red. That was, I think, the issue. But I think the issue for you, Debbie, is you've got to find a way to, once that is completed, the work is, to advertise that facility, because a lot of people are not gonna know about it. I hope you have a PR person on staff, or you plan on doing that in 2014, because how are they gonna know? And like I said, the whole idea is that hopefully that facility can break even.
Right.
And I think it's gonna be beautiful once it's completed.
I mean, and certainly from, being fairly new at the facility and looking at it and looking at the needs, et cetera, for 2014, we are looking to have someone come on board who can do the admissions component, community relations, so we can get the word out there in terms of what we have, and also, quite frankly, be competitive with your admission process, which is got to be live, it's got to be fast, and the competition has put resources into that, which we as a county facility just haven't had. And looking at at the Unit 1 and what will come to be as far as the subacute short-term rehab component of the facility, that we will see a number of people that will come in for such a shorter amount of time. The number of admissions and discharges will become much faster. And the best way I look at the nursing home of today, when we look at the subacute, I always describe it as the hospital of yesterday, because what we used to see in hospitals in terms of length of stay has been ratcheted down to such a small length of stay that many people have to go someplace else rather than home, as that in-between to get better, whether it's recovering from a stroke or a fractured hip, or a complex clinically medical issue, and then get that care and then go home from there. Different than what many of us consider as the traditional nursing home resident who came and or comes into the facility, and that becomes their home for the rest of their lives, which at the moment, that's the majority of who we take care of.
Okay, any other questions? Okay, we'll move on to the resolutions. Public Health Resolution to amend Resolution 28213 to include one additional authorized New York State Education Department provider for services rendered.
Move it.
Kathy, Jonathan.
Okay, any questions?
This seems to be something that is,
It's mandated.
right, that I get. Okay.
It was left off back in July, I think it was. No,
Was there a
August.
reason why that, Nancy?
There was actually a name change. This organization has been providing these services all along. They reorganized and legally changed their name, so we have to add their new name to the list.
All the other ones are approved already, just adding Jack and Jill.
They were on before, changed the name, so
Yes.
now we're amending. Any other questions? All in favor? Any opposed?
4-zip.
Okay, did anyone, Debbie, did you have something you wanted to add?
No, not today.
Is Lesha here? Lesha?
Yes.
Did you have anything you wanted to add?
Sure. Youth Bureau funded summer recreation programs have come to a close now for the season. While they were operating, I was able to go out and monitor each of the summer rec programs. And I'd just like to report that they were really doing a nice job. The programs were well staffed, they were clean, the activities were well planned and thought about, and the children just seemed to have a really great time. Also, some of the summer rec programs were summer feeding sites for the kids, so the children were able to get a free breakfast and lunch while they were at the program. And some of them were open sites where any kid from the community could go in and get a free breakfast and lunch, just as long as the site is providing it. While I was doing my program monitoring visits, a lot of the summer youth programs reported an increase in the number of youth served this summer. They said that the largest population to come on board was the preschool population. So I thought that was really great that they're now extending their services to even preschoolers. And that's it. Thank you.
Thank you, Lesha. Anybody else? Public comment? Oh, Nancy, you had something?
I just wanted to mention an update on our community health assessment process. We're having 2 focus groups tomorrow, one with our Rural Health Network partners, and a second one in the evening for the public. And from those focus groups, we hope to have some information that will inform as we go forward to set priorities for addressing health issues. And that process has been continuous, and we should be starting to finalize some of those reports November.
Okay, thank you. Public comment? Motion to adjourn?
Jonathan,
Second?
Kathy.
Lunchtime.
Yeah, we do.